Ozempic and Wegovy are some of the most popular drugs in the country, driven by their remarkable success treating diabetes and obesity. But the drugs are extremely expensive, and the drug maker's CEO appeared on Capitol Hill today to face questions about why those prices are so high. William Brangham reports.
What we are dealing with today is not just an issue of economics.
At a Senate Health Committee hearing, Chairman Bernie Sanders, independent of Vermont, pressed the CEO of Novo Nordisk about why Americans pay so much more for the same drugs compared to other nations.
The net price for Ozempic is still nearly $600, over 9 times as much as it costs in Germany. And the estimated net price of Wegovy is over $800, nearly 4.5 times as much as it costs in Denmark.
CEO Lars Jorgensen defended his Danish firm, pointing the finger for high costs principally at the U.S. healthcare system.
We don't decide the price for patients. That's set by the insurance companies.
He specifically blamed what are known as pharmacy benefit managers, or PBMs. They act as third-party middlemen between drug companies on one side and insurers, pharmacies, and hospitals on the other, often determining which drugs get covered and at what prices.
Insurance companies and their PBMs, the big conglomerate, have more than doubled, actually close to tripled their profit.
Jorgensen argued those prices are high because Novo Nordisk has to pay the PBMs rebates to ensure his drugs are covered. More expensive drugs lead to higher rebates. But Sanders said he'd received pledges from major PBMs that would change that equation.
We have in writing, we will certainly share it with you, commitments from the 3 major PBMs that if you substantially lower your list price, they would not limit coverage. Will you work with this committee and the PBMs?
If it works in a way where patients get access to a more affordable medicine.
Republican Roger Marshall of Kansas echoed the point that PBMs should be the focus.
Novo Nordisk is not the villain in this story. They're a hero. We should be here celebrating this miracle innovation.
Fellow Republican Bill Cassidy of Louisiana.
We still have to preserve the profit incentive for the creativity for drug companies to invest in order to develop the drugs that are going to positively affect the burden of disease in our society. That is the tension.
The hearing comes at the same time a new government study finds that in the last 10 years, the U.S. obesity rate remained largely unchanged at about 40%, and that severe obesity rose slightly in the last decade.
And we talk about the cost of the medicine, but it's really the cost of the diseases that's breaking the system.
Jorgensen told senators that the price of Ozempic and Wegovy pales in comparison to the hundreds of billions that diabetes and obesity cost the U.S. every year.
These are very, very expensive diseases, and we talk about the cost of the medicine, but typically in these diseases, the cost of the medicine is less than 10% of the total disease burden.
Experts predict that one or both drugs may be involved in the next round of Medicare price negotiations. For the PBS NewsHour, I'm William Brangham.